What's good? If you've had injuries over the years, you may have considered physical therapy. If I rest, is it going to help me? And over time, things may just not get better. So like me, let's talk about why you might consider PRP, and I'll tell you why I'm about to get it tomorrow. For those of us that have these nagging injuries over the years and we're not 21 anymore, and physical therapy has not helped and resting has not helped enough to where it's still debilitating, who doesn't want to have less pain and feel better, still be able to do more? So of course, next stage these days would be regenerative therapy, specifically platelet-rich plasma or PRP. So for me, over the years, my right shoulder, I'm also a righty, I work with my righty on a mouse, etc., etc. I've had pain from here to pretty much here at least half the time. If I do a lot of push-ups and pressing, this shoulder just gets all jacked up. So what do I know technically before I make all my decisions? Recent MRI, cervical vertebrae, neck area. We have spinal stenosis of cervical region, brachial plexus disorders. Awesome, brachial plexus, cervical spine area. There's narrowing of the disc C2, C3 through C5, C6. C3, C4 broad disc bulge. C5, C6 broad disc bulge, causing mild stenosis. And whatever neuroforaminal narrowing is. A good sports orthopedic surgeon who specializes in shoulders. This is just from the x-ray. I can tell you what he said also. So based on right shoulder pain, correct, and I'm also a righty, widening of the acromioclavicular joint, the acromion process and the clavicle normally aligned. There's widening of the acromioclavicular joint. The acromioclavicular joint is otherwise aligned. This is consistent with type 2 AC joint separation. So that joint is separated, grade 2, recommended clinical correlation, whatever that means. Some kind of stenosis here, some kind of disc bulge. We've got this joint is grade 2 separation, which I think it's been like that for years. Right about here, lots of pain right there. But specifically, we're getting PRP in that shoulder. So the MRI of the shoulder, and what my doctor told me was MRI of the shoulder, so soft tissue. Also confirming grade 2 acromioclavicular joint separation in the right shoulder. No evidence of rupture. Low to mild grade fraying of the bursal surface in the supraspinatus, associated with extrinsic compression by the acromion. There is marked supraspinatus tendinosis. That's the key, tendinosis, not tendinitis. Rotator cuff is intact. So essentially, what does all this mean? I had a bunch of pain through here that's come and go for many years, but my shoulder is the main cause of it. What do 2 different MRIs, 3 different doctors, and an x-ray tell me that I probably already know? It's jacked up in this motherfucker right here. It's jacked, right? So what do we learn from the technical aspect of it? We know that there's some issues with disc bulging and some stenosis here, that this AC joint is a grade 2 separation, and there's tendinosis inside the shoulder. When we went to the guy who's actually doing the PRP and he did an ultrasound also, it's Dr. Jace Provo who's doing this PRP. He used to be the head orthopedist for the NBA, apparently, which is dope, I think. Also a martial artist. He also noticed bursitis in the bursa sac here. So basically, this area is jacked. So the tendinosis cannot be repaired with physical therapy. So I'm electing to get some regenerative therapy. And I'm hoping this is something I went back and forth with the doctors, that it's not just going to be here, because the issue is here, and there's some issues here, and this whole area gets jacked. Obviously, this can be getting jacked, and this can be compensating for it, but I want to make sure that this is going to feel amazing, and the rest of it's still going to hurt, because it's really just this whole thing. It's not all the time, but it's enough that it's debilitating. Can't really do regular push-ups, and a lot of pressing as much as I wanted. That shoulder just jacks up. So I'll let you know how it went, and we'll see how effective it is, but is it worth the $1,500 that I'm about to pay cash?